What's up, AP Psych? Welcome back. So we are moving on to our fourth set of notes here in this mental disorders and psychotherapies unit. We're moving on to depressive and bipolar and related disorders. So let's jump right in to some of the most commonly referenced disorders that we know of. So these are all formally known as mood disorders. Right? And so it's just important to understand how they used to be defined. And mood disorders were disturbances in emotional feelings that were strong enough to interfere with everyday living. Okay, and then we're getting back to that dysfunction and distress and deviant, right, of the 4Ds again. Okay, now they used to be known as mood disorders, but they've been categorized in two different ways. So the big two categories that we're going to discuss are major depressive disorder and bipolar and related disorders. That's how the new DSM-5 categorizes them today. So first up, we have major depressive disorder. And this is one of the most common mental disorders that people think of in the world today. Oftentimes, it's been referred to as the common cold of psychological disorders because 6 to 10% of the US population is diagnosed as clinically depressed. Right? It's the number one reason people seek mental health services. Okay, so it's the number one reason people go, even over anxiety disorders and things like that. Depression is number one. So women are twice as likely as men to experience major depression. Approximately 1/4 of all females will experience an episode of major depression at some point in their lives. So it's very common. Now, this is not to say that men do not experience depression as well. They do, and some of the prevailing wisdom is the fact that, societal norms and expectations maybe prevent men from being as open and honest with their feelings and seeking treatment. And men, maybe they deal with it in other ways, such as self-medicating with alcohol and drugs and things like that, rather than seeking mental health treatment. So that could be one of the potential explanations as well for the higher rate of women reporting and seeking treatment for depression. As we move along, some of the symptoms you have to in order to be clinically diagnosed with major depressive disorder. These symptoms must last for at least 2 weeks without a cause. Okay, so no traumatic event or anything like that that you can tell that's causing this depression. Or for those who are grieving, symptoms must last for at least 2 months. Okay, the difference here being that if you go through some major traumatic event like the death of a family member or something like that, and you start to experience depressive symptoms, that's kind of a natural event, right? And it becomes abnormal once it passes that 2-month mark. So that's why the difference in symptomology and diagnoses. So either depressed mood or loss of interest in pleasure in almost all activities, especially ones that you used to love and really enjoy. So I think a big differentiation we need to make here is when people hear the word depression, they often think sad, right? But when we think depression, we need to think similar to, if you think back to when we went over altered states of consciousness and our drugs that we discussed, depressants and what they do to our system, they slow down the central nervous system, right? They slow down the functioning, they slow down the processing. That's exactly what depression is doing also, right? So it's not just about sadness or mood. That's why they changed the name, right? It has a lot to do with our central nervous system and the processing that's occurring there. So in addition to that, you need at least 4 of the following symptoms: marked weight gain or loss, constant sleeping problems, which could be a result of the brain chemistry impacts of depression, agitated or greatly slowed down behavior, right? Depression, slowing down the central nervous system, slowing down your processing, slowing down your peripheral nervous system and your actions. Fatigue, again, there's that depressant. Inability to think clearly, feelings of worthlessness, and frequent thoughts of death or suicide, right? So at least 4 of those symptoms, in addition to your depressed mood and loss of interest or pleasure in almost all activities, especially ones that you used to enjoy. So what are some causes of this major depression disorder? Biological, there's a lack or insufficient amount of certain neurotransmitters. And we'll get into this more when we get into treatment and we talk about things like SSRIs and SNRIs, which are selective serotonin reuptake inhibitors and selective norepinephrine reuptake inhibitors. Those help increase the amount of these neurotransmitters that you have in your brain, because an imbalance in serotonin, norepinephrine, and dopamine can all result in depressive symptoms and depression. So that's from the biological standpoint. From a social cognitive standpoint, there's negative thoughts that influence negative behaviors that influence the situation and in turn influence our thought patterns. So that's quite the cycle we have here, and we're going to see on the next slide the depressive cycle. Okay, and again, when we get into treatments, there's something called cognitive behavioral therapy, which helps you change the cognitive part, those negative thoughts, so that then you can change those negative behaviors, which result in a cycle of negative thoughts, negative behaviors, back to negative thoughts. Okay, and that's that cycle we were just discussing. So you have some type of negative stressful event, and your thoughts and explanatory style turn negative. You have these pessimistic, ruminating thoughts, right? And that leads to a depressed mood, a hopeless, depressed state. And that changes your behavior and in turn, again, impacts the way you think even more. So it hampers the way that we think and act. And then that fuels our own personal rejection. And the cycle gets worse and worse, and you fall into a major depressive cycle. All right, in addition to major depressive disorder, there's something called persistent depressive disorder, and this is formerly dysthymia. It would be good to know both of those names just in case. But although this is considered less disabling, it is marked by chronic low energy and low self-esteem. So we have that depressant aspect, but also low self-esteem. And it's seen as more of a low-grade, longer-lasting depression. So it doesn't rise to the level clinically of major depressive disorder, but it still has a debilitating somewhat impact on your life for a long time. Okay, so moving on to our next category. We just touched on major depressive disorder. Now we're getting into bipolar and its related disorders. So first up, we'll just hit bipolar in general. It was formerly called manic depressive disorder, which that name gives insight into the characteristics of the disorder itself. It's an alteration between depression, which we just discussed, and mania, and that signals bipolar. So some of those depressive symptoms, that depressant aspect, gloomy, withdrawn, inability to make decisions because your processing speed has slowed down, tired, slowness of thought, depressing, right? Then you have manic symptoms on the other side, where elation, euphoria, desire for action, you're hyperactive, you have multiple ideas, you're loving life, you have tons of energy, you could stay up for days at a time because of these manic episodes. So some of the most famous writers in history, writers, poets, composers, have dealt with bipolar disorder. And during their manic phases is when they've done some of their best creative writing because they've stayed up for days. They've had multiple ideas. They've written nonstop for days, right? And their work drops off during their depressive phases as they become recluse and they have a very sad outlook on the world, right? So it's a very up and down disorder that causes a lot of creativity as well as depressing sadness and hopelessness. Now, the bipolar related disorders, we have bipolar in general, but there's a few types. You have bipolar 1. This is the classic bipolar disorder that we just discussed. You experience manic episodes and usually major depressive episodes. You swing back and forth over the course of weeks. Bipolar 2, you experience mania to a lesser degree. It's called hypomania. So your manic episodes are not as long as your manic episodes are with bipolar 1. So most patients who experience hypomania do not see it as a problem, but the people around them may be concerned about their erratic behavior. Again, so that reaches the distress to yourself or others of the 4 Ds, right? Hypomania lasts around at least 4 days, whereas mania in bipolar 1 oftentimes exceeds a week. So there's a difference in length and intensity between those two in your manic stage. And our last disorder is cyclothymic disorder. And this is where you have hypomanic and depressive symptoms for at least 2 years, but your symptoms do not constitute full major depressive episode or mania, right? So you're not reaching the level of the huge mood swings involved in bipolar 1 or 2. It's a little bit more mild, but it is lasting a long time and impacting your life. Okay, so a few causes of bipolar disorder and the related ones we just discussed. Biological, there's evidence that it can be inherited, right? And the inherited predisposition is very strong. 2/3 of those with this disorder have a family history of mood disorders of some kind, right? So there's clearly a genetic component, to bipolar disorder. And there appears to be some psychosocial factors in triggering new episodes or preventing them. So the way that you're thinking or the events that you're experiencing in your environment, those stressful events can often trigger a manic episode or a depressive episode. So we have a genetic connection, but we also have the environment that triggers these episodes. So I'm going to remind you again of that diathesis stress model, how we have genetic markers that can predispose us to a disorder, but those events in our environment are the things that really trigger and turn them on. So the bipolar brain, just to give you an idea of what it looks like when people experience depressed and manic states, this PET scan shows that the brain energy consumption rises and falls with manic and depressive episodes. So this person's brain scan, May 17th, they're in a depressed state. Right? The next day, maybe they experience an event that triggers a manic state, and you can see the massive change in brain activity. So when we talked about depression and the idea of depressant drugs and what they can do to your central nervous system and your brain activity, look how slow that is, right? Compared to a manic state where your brain is essentially on fire and you can't slow it down. You could be up for days at a time because of the extreme activity that's going on in that manic state. And you notice that manic state lasts for about 9 days. So it's over a week. So this person most likely has bipolar 1. And they get back into that depressive state, extremely reduced brain activity on May 27th. So I know some of you are thinking potentially that bipolar might sound a little bit like borderline personality disorder. So just to differentiate that for you a little bit, people with BPD cycle through their emotions far more quickly than those with bipolar disorder, up to several times a day, right? So BPD is those shifts in your emotions and your relationships happen much more quickly. Whereas with bipolar disorder, those patients, you could experience them every few days or over the course of a week or so, right? And bipolar is also due to a chemical imbalance in the brain, as we saw in that brain scan, while BPD is not necessarily due to a chemical imbalance, although there may be some biological impacts there as well. So that was a quick one. That wraps up our formerly known as mood disorders, but major depressive disorders and bipolar disorders. And let me know if you have any questions.